I'm Andrew Rowland. I'm a consultant in children's emergency medicine and I'm a fellow of 2014. I went to the USA and to Southeast Asia, specifically to Cambodia, Malaysia and Singapore, to look at how we can turn the tide of child abuse, exploitation and neglect back here in the UK. Being awarded a Churchill Fellowship has completely changed my professional career. I still work as a children's emergency medicine doctor, but a whole load of avenues have opened up to me that never would have been available to me had I not been awarded the Churchill Fellowship. I've made new academic contacts around the world. I've engaged with partners from a health point of view, a social care point of view, and from a charity sector point of view. I've been able to implement a number of the findings myself from my report in my own practice. But what's really exciting is that other organisations have grasped onto some of the recommendations I made and have started to implement them themselves. So when I told my employer that I wanted to apply to become a Churchill Fellow, they were a bit confused initially. They said, well, what's this Churchill Fellowship Award you want to apply for? And I told them what it was about. I told them that it was about individuals from the UK going overseas to bring back best practice, to write a report, to come up with some recommendations, and then hopefully, locally, nationally, perhaps even internationally, be able to implement those recommendations. My employer said, well, why wouldn't you apply? So enthusiastic of my employer being, that last year, another member of staff at the same hospital where I work also applied for a Churchill Fellowship. And the response from my employer is, why wouldn't we support that? What that says to me is that if you have the right employer, or you have an employer that is really forward thinking, they're the kind of people who are going to support you in this kind of endeavour. Those kind of employers really have the future of the UK at their heart, and they really understand that it's individuals who are going to make changes to society. Why wouldn't they support somebody who was placed in that position, such an amazing position by the Winston Churchill Trust? For those of us who work within medicine and health, there are a number of different funding areas that are available to us. But the Churchill Trust offers something what I think is completely different. You don't have to comply with a rigid set of guidelines and a rigid set of rules. You just need an idea that you're prepared to work with, and an idea that you're prepared to research and write up when you return back to the UK. You're not going to have to fill in many hundreds of words of an application. In fact, actually, the one thing that you can do to reduce your chances of success is to try and fill in many hundreds of words of an application. They're not looking for that. They're looking for somebody who can summarise their ideas very succinctly in an application that's generally counted by characters and not words, certainly not pages. Now that makes it very different from the normal funding streams that are available within medicine and health. They're after good ideas, individuals who can implement those ideas, and people who are prepared to disseminate them. They're not so interested in putting hoops or obstacles in your way. You just need to have a good idea. The Churchill Trust are not interested whether or not you've been to university, whether or not you have a degree, if you have a higher degree, what qualifications you have. What they want is, do you have a good idea? If you have got a good idea, are you a really positive advocate for that idea? Can you go abroad and do some research about it? And can you write a report that some recommendations could be implemented from when you get back to the UK? It doesn't matter what your academic qualifications are. It doesn't matter what your background is. They just need people with a good idea. If you're watching this video, you probably have a good idea. You should apply.